Welcome to our Savvy Ladies Wednesday Wisdom webinar. My name is Maggie Montemuro, and I'm the Marketing Coordinator at Savvy Ladies. If you have a question during the presentation, please type it into the chat box. And if you're joining us by phone, you can email your question to info@savvyladies.org. Today's presenter is Dr. Sunanda Chugh, CEO and Medical Director of Anand Medical Spa. Dr. Chugh has a special interest in the impact of the aging process on the facial structure and body and how these changes affect one's self-image. She believes in one-on-one personal care and provides full attention to help her clients not only look great, but also feel confident. We want to thank you for your time today, Dr. Chugh, and I'll hand it over to you.
Thank you so much, Maggie, and to the Savvy Ladies for inviting me. Good afternoon, everyone. Thank you for taking the time to join me today. I'm very excited to be sharing my tips on preventing the aging process and putting your best face forward. I would like to begin by asking you a couple of things. Can you relate to any of these scenarios? Are you tired of looking tired or people telling you you look tired even when you don't feel tired? Are you an entrepreneur, CEO, or public speaker that needs to command the stage with confidence? Are you trying to update your website picture? Maybe you're starting to get out into the dating scene and want to look refreshed. Or perhaps you just want to improve something about your appearance that has been affecting your confidence. Today, I will be speaking about how you can prevent the aging process and do some simple things to help you look and feel like the best version of you in any of these scenarios. Before I begin, I would like to share my personal story. If acne was not enough, as a teenager, I also had a little facial hair, a little peach fuzz above my lips. And I remember a boy in my class making a comment to the effect of, "Why don't you shave off that mustache?" Yeah, it was a pretty mean comment. Although this comment was amusing for the boy, it affected my self-esteem and made me lose self-confidence. I felt bad about my appearance for many years. This became a source of distraction for me. Instead of focusing on more important things like my family and school, I was often focused on the facial hair and wondering whether people were paying attention to me or what I was saying, or were they staring at the facial hair. I tried many things to fix it, and perhaps some of you ladies can relate to this. I tried bleaching it, which made it look worse when the sun hit the hair. I tried plucking it, I tried waxing it, which actually made it look thicker and coarser. And then I tried electrolysis, which gave me ingrown hair, and it took a long time and it was not very effective and very painful. Finally, about 8 years ago, I discovered a permanent way to get rid of it with a cosmetic procedure, specifically laser hair removal. The hair was gone, and along with it, the shame that I felt for many years. This whole experience unknowingly planted a seed in my head and later inspired me to start my practice, Anand Medical Spa, with the mission of helping people who also had concerns about their appearance that affected their self-confidence as I had. Here are some interesting facts. According to a survey from 2014 by the Today Show and AOL, 60% of women have negative thoughts about their appearance compared to 36% of men on a weekly basis. And 73% of mothers worry regularly about their appearance. I'm not a mother myself yet, but I can imagine how all the late nights staying up with the kids, stress from worrying about your children, and from working while being a mom, that can take a toll on one's appearance. This survey also found that adult women in general worry more about their appearance than they do about finances, family relationships, professional success, or even their own health. And this is why I would like to talk to you today about how you can do some simple things to prevent the aging process and put these worries to rest so you can focus on more important things like your health, family, relationships, and finances. I would like to begin by talking about the aging process. I think it's important for you to understand exactly what happens. A number of things occur during the aging process, including the top layer of the skin, your epidermis, which we'll focus on more later, begins to thin, leading to more visible capillaries and veins. I often get patients asking me, why are they all of a sudden starting to see these veins pop up on their forehead? And I tell them they've been there all the time, but now that the skin is getting thinner, they're just becoming more visible. There's also an increase in the size of melanocytes. These are the cells which produce a pigment called melanin. Melanin is the pigment that gives color to your skin, and this is actually your body's attempt to protect you against the ultraviolet A and B rays from the sun. So the more sun exposure you have, the more likely you are to get what's called sunspots or age spots as you get older. Then there are blood vessels in the dermis or deep layer of the skin. They become fragile, leading to bruising. So as you get older, you'll see that you become more susceptible to bruising. Also, the sebaceous glands produce less oil, especially in women due to drops in estrogen after menopause, which leads to dry skin, amongst other things that women complain about. In addition to all the above, if that was not enough, as we age, we begin to develop fine lines, wrinkles, and sagging skin. The sagging skin then results in jowling or loose skin around the jawline, drooping or hooding eyelids, deep folds such as those around your mouth, and a double chin, which just makes us look old. All of this is due mainly to the loss of decreased production of key components in the aging process, including collagen, elastin, fat, and hyaluronic acid, and this is what I will be focusing on today. I would like to start by talking about collagen. Collagen is a very important protein that plays a huge role in the aging process. It is a complex protein found throughout our body, and specifically in the skin. It makes up 75% of your skin, giving it support and structure. Collagen, along with elastin, fat, and hyaluronic acid, helps us maintain that youthful appearance. So if you look at the slide over here, you can see a cross section of the skin, and the red dot here is my pointer, so just follow that. So the top layer here, which is in peach, is your epidermis. Your epidermis is the waterproof layer which protects your skin against harmful environmental damage, including the sun, infections, and also gives us color due to that pigment we just talked about called melanin, which is produced in the epidermis. Then underneath it is what's called your dermis, this light pinkish layer here, which is like the cushion for your skin because it helps to maintain the integrity of your skin. And this layer here contains the important components we talked about, such as collagen, elastin, hyaluronic acid. So if you look at the magnified picture here in the front, you can see these thick strands here. These are your collagen strands, which is again very important to maintain the structure of the skin. Then these thinner strands along here are elastin strands. So elastin is very important for maintaining the elasticity or balance of the skin. And then lastly, these bubbles, these bluish bubbles here are hyaluronic acid molecules. And hyaluronic acid is very important because it draws water molecules, it attracts water molecules and gives volume, and also gives your skin that youthful glow. On the right here, you have here a cross section again of your skin, and this is in the aging skin. So before we talked about the skin before it starts to age. So on the right here, again, you can look at the epidermis. So as we begin to lose these important components, which are in the deeper layer of your skin, your dermis, we see less collagen in this magnified version here. We see less elastin strands, and also we see less hyaluronic acid. So the skin begins to lose its cushion or integrity here, and then the epidermis becomes more malleable to producing things like fine lines here, then wrinkles, and then deep folds, and eventually sagging skin. So this graph shows here, let me just get my pointer back. So this graph shows here, as we get older, we're starting to lose collagen at 1% a year as early as your mid-20s here, and then it progresses onward. And again here, this is a cross section of the skin. So here we see the dermis, the cushion of your skin, which has all those important components. And as we're getting older, we start to see less and less of those components, and then fine lines start to form, and then deeper wrinkles and folds. In addition to actually the collagen that we talked about that goes down as we get older, we begin to lose fat. And as much as we do not like fat in our body. We actually need fat in our face to maintain that youthful appearance. So here on the left here is the youthful face, and here in yellow are these fat globules. And as we get older, we start to lose the fat. So you can see around the eyes, we're starting to lose fat, which leads to that sunken eye appearance, that hollowness under the eyes. And then we also start to lose the malar fat in the cheeks here, which causes our cheeks to start sagging. And then we develop these what are called nasolabial folds or smile lines around the mouth. In addition, there's redistribution of fat near the jawline, which unfortunately causes us to lose that sharp jawline that we had when we're younger. And this also results in what we call jowling. So the slide here demonstrates what happens as we get older by decade. So to the left here, we have a woman in her 30s who looks fairly youthful. And a decade later, as we begin to lose those important components that we talked about, collagen, fat, hyaluronic acid, we start to see fine lines on the forehead here, between the eyebrows. In addition, we start to lose fat under the eyes here, and that results in that sunken eye appearance. And then we start to lose fat in the cheeks, causing these folds here, the nasolabial folds, to develop. In addition, we get the jowling effect along the jawline, and also some laxity or loose tissue under the chin and neck. And a decade later, in the mid-50s, here to the right, we're starting to actually get, the fine lines are starting to get etched in, and they're becoming deeper wrinkles here on the forehead and between the eyebrows here. In addition, we're getting more fat loss under the eye here, resulting in even a worse sunken eye appearance and hollowness. And also, because of the loss of collagen, you can see here that there is some loose tissue that's starting to develop under the eyes, or we start to get those bags that people really just don't like, and which makes them look older. In addition, we're losing further fat in the cheeks, resulting in even a further deeper fold or smile lines around the mouth. We also start to get these folds at the corner of the mouth called the marionette lines, and that the jowling is starting to get worse. And of course, there's more laxity under the chin and neck, resulting in that double chin appearance. So now that you guys are all experts on the aging process, what can we do to prevent it? I will be focusing on three main components in preventing the aging process. First is prevention of collagen loss. Second is production of collagen. And third is hydration, which also includes repletion of volume with hyaluronic acid, which restores volume that is depleted due to fat loss and loss of hyaluronic acid as we age. Let's first talk about prevention. I'm a fond believer in preventative medicine to prevent development of medical conditions as well as preventative aging. So all you sun worshipers, pay attention now. 90%, that's right, I said 90% of the collagen loss that occurs in our skin due to environmental factors is due specifically to harmful ultraviolet A and B rays from the sun that damage the collagen in the dermis, or the deep layer of the skin. So one of the most effective ways to prevent loss of collagen is by daily use of a broad spectrum SPF 30 sunscreen that is free of parabens or toxic chemicals. And depending on the sunscreen you're using, you want to apply it 20 to 30 minutes prior to leaving the house, and also reapply it every 3 to 4 hours if you're going to be out in the sun all day, you're on vacation, you're sweating, you're running around, you may be swimming. So definitely don't forget to reapply it. The second thing I would like to talk about as far as prevention is concerned are antioxidants. Antioxidants are very important in preventing the aging process. They protect your skin against free radicals. And what are free radicals? They're harmful chemicals that are generated in the body, as well as by environmental toxins from air pollution, smoke, pesticides, ultraviolet rays. So if you're a smoker, here's another reason to quit smoking. Antioxidants are found in foods and also in your topical creams and serums. There are a variety of types of antioxidants, and they're divided into three main categories. So first are your vitamins, such as vitamin A, C, and E, which can be found in a variety of fruits and vegetables. The second are your phytonutrients or plant nutrients, example polyphenols, flavonoids, carotenoids, which are also found in a variety of your fruits and vegetables. Then there are enzymes made by our bodies, such as superoxide dismutase, glutathione, peroxidase, that require adequate protein intake, and cofactors such as iron, copper, selenium, magnesium, and zinc to provide optimum antioxidant activity. So that's why it's important to have an adequate protein intake, and also perhaps to take a multivitamin, which has these key cofactors in them. These are some foods that are high in antioxidants. My favorite are the berries, so blueberries, blackberries, cranberries. You can throw them in your cereal, put them on your yogurt, or just eat them as is. And then, believe it or not, red kidney beans, pinto beans are a high source of antioxidants, as are artichoke hearts. And if you don't like artichoke hearts, then vegetables such as tomatoes, which are high in lycopene, which is a phytonutrient, spinach, broccoli. Walnuts are wonderful. They're a great snack, and they're also high in omega-3 fatty acids, which are great for your hair, your skin, your heart. Green tea is also excellent. Having 1 to 2 cups of green tea a day instead of coffee is a great idea. In addition to consuming antioxidants, look for skin products that contain the following antioxidants, preferably all of them. When it comes to preventing aging, we want a multifaceted approach. So vitamin A, for example, your retinoids, and it's better to have prescription strength retinoids. Vitamin C, there are a variety of types, and you want to look for specifically THD or tetrahexyl decyl ascorbate. We carry a medical grade product that contains 30% of THD ascorbate that cannot be found over the counter and is more effective than other forms of vitamin C, which are not very stable. Then there's vitamin E or tocopherol. The third thing I would like to discuss as far as prevention of collagen loss is sleep and stress, especially for New Yorkers who are very busy, stressed out individuals who often do not get adequate sleep. I mean, we're running around, we have our jobs, we have family, we have other things, other obligations, and then sometimes we just skimp out on our sleep and we're stressed out. So this is something really important to remember. Here's an interesting fact. Did you know that excessive stress and lack of sleep increases the levels of a hormone called cortisol? Why is this important in the aging process? This elevation in this hormone cortisol eventually leads to a breakdown of collagen and hyaluronic acid, the molecules again that give our skin that youthful glow and bounce. So what can you do about this? What I find beneficial myself to help with both of these is doing 5 to 10 minutes of meditation or just some slow, deep breathing. And if you don't know how to meditate, there are tons of YouTube videos out there. I can also give you tips. And then in addition, here's another fact. Studies have shown that regular exercise routine helps decrease stress and depression and improve sleep and cognitive function. So if you can gain so much from just doing 5 to 10 minutes of meditation or deep breathing and exercising, why wouldn't you do that to help you with this? So we talked about how we can prevent the loss of existing collagen in our skin. Now I would like to talk about how the second component preventing the aging process can help us, which is production of collagen. It is important to keep in mind that you cannot apply topical collagen or take collagen supplements. So if there are any skin products that claim to have collagen, they will not be effective. Increase must be induced somehow. One way to do this is through creams that contain prescription strength retinoids such as Retin-A or Renovate, which exfoliate and stimulate collagen production. And then there are medical grade skin products that contain growth factors that can also stimulate collagen production, or creams with appropriate peptides which trigger collagen production. Unfortunately, majority of the over-the-counter creams that claim to do any of this do not work, as they are not in sufficient concentrations of the active ingredients, or cannot use the active ingredients found in medical grade products. We carry 2 lines of medical grade skin products at Anand Medical Spa that contain both of these ingredients. So although the right topical creams can help, production of collagen is best increased by a revolutionary non-invasive technology called ultherapy, which uses focused ultrasound energy to boost your own body's collagen production to help lift and tighten areas of loose, sagging skin. This is the only FDA-approved procedure to give a non-surgical eye lift, chin lift, neck lift, and most recently approved last June to treat the fine lines and sagging skin of the décolleté or upper chest area. What's really great about this technology is that most people require only one treatment and the results appear in 3 months. So this is what the machine looks like. So here in this slide is an actual ultrasound. So this is the same technology used to visualize the development of a fetus when a woman is pregnant. So it's a very safe technology. And the provider who's treating you can actually visualize exactly where in the skin they're treating. So it's very safe. So you can see here, this in the white and black is a cross section of the skin. So as I'm treating, I can actually see where in the skin am I actually treating. Am I in the dermis? Am I in the fat, which of course we don't treat. So we want to make sure that it's safe and we're in the right layer. And then here on the bottom here, you can see the actual areas that we treat. So we can treat the eyes to give an eye lift, the lower face here for a facelift to help with the jowling here along the jawline, then the chin lift, neck lift, and we can also do the décolleté area, which is not depicted here. Next, I would like to show you exactly how L-therapy works. Before I do that, let me review with you the different layers of the skin. So the top layer here, which is really thin and in white here, is the epidermis, which is a protective layer. And then underneath it is the dermis, again in peach here, which is the thicker layer, is the cushion-like layer, which has all those juicy components to it, the collagen, elastin, hyaluronic acid. And then underneath it is the fat layer, which again, remember we need fat in our face because that maintains our youth. Underneath it is also the layer here in white is also a very important layer. It's a layer of connective tissue called the SMOS layer, and it protects the muscle that's below it. And the reason that this layer is very important is that when surgeons actually go to operate and do facelifts, they're going down to the second level here to tighten and lift the connective tissue. And L-therapy is the first technology that is able to stimulate collagen production at the second level called the SMOS layer and accomplish a non-invasive facelift, meaning no cutting and no downtime. On this slide here is exactly what happens during the L-therapy treatment. So here on the top here is what's called the transducer, and this is the device that delivers the focused ultrasound energy to treat and also allows me to visualize what layer of the skin I'm treating. So it works by creating what's called small micro-injury points. So if you see these orangish ovals or dots here, these are small micro-injury points or thermocoagulation points, which is exactly what's stimulating the collagen production at these two layers. So first we treat in the deeper layer, the SMOS layer, where surgeons go to operate. And then we go to the second level here again, which is the dermis, or the deep layer of the skin, which also contains the collagen. So no other technology goes to these two layers. The older technologies such as thermage and lasers only treat at the dermis area here, the dermal layer. It does not go to the SMOS layer. So this is the first technology to achieve these two levels. So this is what happens in a period of 3 months. This is a picture of the skin, the cross-section of the skin after it's been treated. So in a period of 3 months, there's a progressive increase in collagen. So I'm going to just go back to the original slide, and you can see in the dermis that these strands here, these little white strands, there's not much of the strands, and also the skin you can see here is looser or wavier, if you may. And then if you go to the slide after the treatment, the skin is more lifted and tighter. And you can see that there's increased amount of collagen here, and there's also a reorganization of the connective tissue here as well, so that the overall appearance of the skin is more lifted and tighter. Now let's look at some before and after pictures. This is a before and after picture of a middle-aged woman after one treatment with L-therapy of her neck, chin, and jawline. And just get my pointer. So as you can see here, before treatment, here's that jowling effect again, that loose skin that sits by the jawline and takes away from the nice sharp jawline that we're used to having when we're younger. And then, of course, she has more lax or loose tissue here under the chin and neck. And after 90 days, because that's how long it takes to stimulate the collagen, you can see here how her jawline is so nice and sharp. There's less lax or loose tissue under the chin and neck, and just an overall lifted and tighter appearance after 90 days. This is another before and after picture of a gentleman now. So if there are any men listening in on the webinar, this is a great procedure for men too, or if you ladies have husbands or partners that may be interested, it's a great procedure for men as well. So this is a profile picture here of a gentleman receiving an L-therapy treatment. And again, this is before the treatment. So again, you can appreciate the jawline here isn't as defined. And after 90 days, it's a lot more defined. And there's less loose tissue under the chin and neck. It's tighter. And, you know, he just appears to be more youthful here. In this slide here, this is a picture of an upper face treatment of L-therapy to achieve an eye lift. In the before picture, there's hooding of the eyelids. And the way women, you know, usually complain about this is as they're getting older, they say that they're not able to put their makeup on as properly, their eyeshadows and eyeliners, because you can see here the upper eyelid is hooding here. You can barely see it. And 90 days after the treatment here, you can appreciate more visibility of the upper eyelid, and you can also see that there is a lifting of the eyebrow too. So the eyes just look more open, and you know the eye is a very important area because the first signs of aging do appear around the eyes because the skin is thinner there, and of course when people are speaking to you, they're looking at your eyes and your mouth, so you want to look younger and you want your eyes to look more youthful. Next is a treatment of L-therapy of the décolleté or upper chest area. So this was just FDA approved last year. L-therapy is getting more and more FDA approvals. So now we can also treat the décolleté area. And again, here after 90 days of treatment, the skin appears smoother and there it's more lifted, there's less lines, and you can wear your pretty summer dresses and tops without feeling self-conscious. Let's now talk about the last component in preventing the aging process, which is hydration and hyaluronic acid. Over 60% of the body is composed of water. All of our cells need water to function. Dehydrated skin is more prone to aging. It's that simple. So what can we do to remain hydrated? It is very important for us to use a daily moisturizer in the winter and summer. And of course, depending on what season it is, you can use a lighter moisturizer in the winter. Limit alcohol and caffeine intake. And if you're going to drink alcohol, drink moderately and preferably red wine, which is also another source of an antioxidant called resveratrol. And break each drink, if you're going to have more than one drink, break each drink with a glass of water. And if you're going to have caffeine, choose green tea, as remember, it is also a high source of antioxidants. Lastly, drink plenty of water. And I tell people as far as what amount is right for you, the number of ounces you need per day is half your weight in pounds. So if you weigh 120 pounds, it's 60 ounces. But of course, if you're exerting yourself, you're exercising a lot, then certainly increase your uptake of water. Or let's say you're sick and you have a fever, your body is dehydrated then, so you need more water as well. What if you lost significant volume from fat loss or depletion of hyaluronic acid in the skin with aging? Then we can replete this with dermafillers. Dermafillers such as Juvederm and Voluma are made of hyaluronic acid and are very safe, as hyaluronic acid again is a substance found naturally in our skin that gives it volume. Dermafillers can treat the following areas, so deep folds such as your smile lines and marionette lines around the mouth, under eye hollowness due to fat loss, sagging cheeks, nasal misalignment. Believe it or not, I can actually do a 5-minute nose job with dermafillers, or cheek, chin, and lip enhancement. So, you know, sometimes as we get older, some women complain of their lips getting thinner and they start to lose the shape of their lips. So dermafillers are a great way to restore that lost volume. And what's also great about dermafillers is that the results are immediate and there's no downtime. So let's look at some before and after pictures of dermafillers now. This slide shows a young woman in her 30s who had dermafillers of her nasolabial folds. So this is a before picture on the left, and this is her nasolabial folds or smile lines. And this is immediately afterwards, so the results are immediate. You don't have to wait a week or two. You can see the results right away. And you can see here in the after picture, the smile lines just look smoother, and she just looks more refreshed. And this is a magnified picture of the before picture, before she had dermafillers and after. And again, the smile line is smoother here. Here is another before and after picture of an older woman who had the latest in dermafillers called Voluma, which is FDA approved to lift the sagging skin around the cheeks. And in doing so, it can also help soften the smile lines and improve the jowling in most cases and give a more youthful, refreshed look. So you can see here in the before picture, her cheeks, because of the loss of fat volume, loss of collagen, they've begun to sag. And then because of the sagging, it creates these deep folds and also the jowling. And then this is immediately afterwards with Voluma. Look how refreshed and youthful her cheeks look. It's also made the smile line softer, and there's also decrease in the jowling around the jawline. So it's a wonderful, wonderful filler, and Voluma lasts up to 2 years. So let's review here. I'm sure you guys remember the 3 main components in preventing the aging process. The first is prevention, or preventing the loss of the existing collagen in your skin via sunscreen, antioxidants, adequate sleep, decreased stress. The second component is production of collagen by using medical grade topical skin products, although using skin products is not as effective as non-invasive alt therapy, which we've talked about in length now. And the third is hydration and hyaluronic acid by limiting alcohol and caffeine intake, daily moisturizer, adequate hydration, dermafillers, which are made of hyaluronic acid to replete volume. I just want to take a moment to say that it's important to take preventative measures, of course, but I also think we're very fortunate to live in an age where there are advances in procedures and technology such as alt therapy, lasers, dermafillers that are safe and effective, so we don't have to have surgery or run the risk of surgery to help us deal with certain issues or concerns we have about our appearance that may affect our self-confidence, as I had when I was younger. So who says we have to age gracefully? I say decide how gracefully you will age and put your best face forward. I would like to thank you for attending my webinar, and as a courtesy to all who attended, I would like to help you put your best face forward by extending a complimentary 30-minute consultation with me to discuss any of your specific anti-aging concerns or ways to remedy it, such as below, with L-therapy, again, to lift sagging skin, dermafillers to repeat volume, Botox for wrinkles and excessive underarm sweating. And what a great time now. Summer is right around the corner. It's really hot. Why sweat if there's something you can do about it, which lasts 3 to 6 months? Chemical peels for sun damage, fine lines, and then of course the medical grade skin products that we referred to earlier. Just mention you saw this webinar when you call the number to the right here to schedule, or you can go to my website and book online. Thank you again, and hope my tips will help you put your best face forward.
Thanks, Dr. Chugh. That was great. Just want to say a reminder to anyone, if you have a question, you can type it into the chat box, and we'll move on to some questions that came in. The first question is, how can I protect my skin from free radicals if I live and work in a city full of air pollution?
Yes, I mean, the easiest solution would be to move, but I'm assuming you can't move right now. So the things we talked about earlier is if you can't physically move or relocate, then you certainly have to take preventative measures such as the consumption of foods that are high in antioxidants. And one thing I did not mention, which I want to just emphasize, is that there's a lot of hype about eating organic, and I'm a big fan of it because the antioxidants in organic food actually are higher in antioxidant content than if you just use foods, or rather eat foods that are not high in organic antioxidants. So I would definitely do that. In addition, we talked about certain creams that do have antioxidants that can prevent the aging process. So you have to practice prevention. That's the main thing. And you know, what's interesting is there's a lot of research going on right now. It's a field called epigenetics. And there's research on, you know, doing some things as simple as lifestyle modification. So meditating, exercising, which can actually help protect the genes from damage that's occurring due to all these environmental factors such as pollution. So I would exercise prevention and incorporate important things into your life, like a regular exercise routine and perhaps meditation.
Mhm. Okay, great. And we had some questions come in about age spots for older appearances. Do you have any tips on what can be done for those?
So it really depends on how progressive the age spots are, the sunspots that people call. You know, if you have mild age spots or sunspots, then certainly we carry medical grade chemical peels, which using a series of 3 or 4 peels, you can actually help fade the age spots. What's important to remember is even no matter what you do in terms of getting rid of them, you have to be really careful with the sun, and you have to be very, very vigilant about using sunscreen. That's why I really emphasize that, because again, 90% of the aging process from the external factors occur from the sun. So let's say you get rid of it either with chemical peels or lasers is another option. Then if you go out in the sun, don't use sunscreen, you're out sunbathing, the sunspots are going to reappear. So yeah, there's also lasers. So what I wanted to also add is if they're severe, and you know, this is someone, I don't know how old the person is, but if there's someone older and the sun damage is more severe, then there's aggressive lasers such as Fraxel, but I would only recommend that in severe cases. I don't recommend that for everyone. I generally like to try a more conservative approach first and then try the more aggressive approach.
Okay. Our next question, we had some questions about recommendations from you. Do you have any for over-the-counter products, specifically preventing collagen loss?
I honestly have tried so many, you know, prior to practicing what I do currently, non-invasive cosmetic procedures and wellness. I tried so many over-the-counter products. They just are not very effective. So I stopped using them personally. I do carry 2 lines which have important components that we talked about, such as growth factors, because, you know, there are some over-the-counter products that have peptides in it, but the problem is not all peptides are the same. So they may make claims that they have peptides, but they're not as effective. So I honestly can't, I don't recommend over-the-counter products for aging purposes. Now, if you're going to use, or anti-aging purposes, I mean, if you're going to use it for a moisturizer, then certainly that's okay. But anti-aging, I'm not a big fan of over-the-counter products.
Mm-hmm. Okay, great. Well, thanks again, Dr. Chugh, for such an excellent presentation, and thank you so much for your offer to the Savvy Ladies community. So thank you to everyone who joined us today, and we hope you'll join us again. Thank you so much.
All right, take care.
Bye-bye.